let me introduce Mrs. Lola Bailey, GWAF trustee.
Hello, everybody. My name is Mrs. Mukulala Bailey. I am a trustee of the Gabby Williams Alzheimer's Foundation, otherwise known as GWAF. It's a delight and an honor to be amongst all you distinguished ladies and gentlemen. And I would like to thank you on behalf of the trustees, my fellow trustees, for taking the time to host and attend this Q&A. So this is our first GWAF webinar since the whole COVID epidemic, but even before that, it's our first since our inception in 2017, as we prepare for our country's reopening. This afternoon, you will hear leading voices from a famous tertiary institution, from the top echelons of the private sector, and the voice of the federal government on issues of public health, family medicine, community service, aging, and mental health. You will also learn how we can support the elderly and their caregivers and communities who are disproportionately afflicted with COVID-19. For any of you who are not familiar with the Gabby Williams Alzheimer's Foundation, here is a very short introduction to our foundation. First and foremost, we are a not-for-profit organization established to help fill the gap in dementia and Alzheimer's disease awareness, services, but also advocacy within Nigeria. The Gabby Williams Alzheimer's Foundation has two core missions. Our first mission is to promote dementia and Alzheimer's disease awareness and to reduce its related stigma in Nigeria. Our second mission as a foundation is to identify and strengthen the available patient and caregiver infrastructure for Alzheimer's disease and dementia in Nigeria. One of our strategic objectives to deliver training workshops and webinars for early stage dementia sufferers, dementia caregivers, and all stakeholders in the care of the elderly is taking place right now with this Q&A discussion brought to you via Zoom. The Gabby Williams Alzheimer's Foundation is a partner, an official partner of the Federal Ministry of Health. With FMOH, we have begun the domestication of World Alzheimer's Day in a Nigeria campaign that was launched with our animation entitled Waiting They Do Mama Dupe, a pidgin English infomercial that was screened in cinemas all over Nigeria and also on television stations across Abuja FCT and Lagos State from the 16th of September to World Alzheimer's Day, 21st of September, 2019. I would like to finish my short welcome introduction by telling you a little bit about the inspiration for this foundation. Our father, our dearly beloved Dr. Gabby C. Williams, who passed away on the 27th of July, 2018, went to be with the Lord. Dr. Gabby C. Ayodele Williams was born in Lagos on September the 11th, 1937. His father was Oseni Williams, who was a respected licensed surveyor and the son of a very successful textile merchant, Lawani Williams, of the lineage of Jadiara Williams. His mother was Alhaja Wusamot Shobayo, a very prosperous textile merchant who was well known and well loved across Lagos, known affectionately as Mama Gabby. Dr. Gabby Williams studied medicine in the UK at St. Mary's Hospital Medical School in London. He earned a postgraduate public health degree in the US at the Johns Hopkins University School of Hygiene and Public Health, Baltimore, MD, USA. Dr. Williams held a number of very important professional appointments, including, among others, Medical Officer of Health, Lagos, Chief Health Officer, Lagos City Council, Director, Disease Control and International Health at the Federal Ministry of Health, a representative of Nigeria on the executive boards of the World Health Organization, in addition to UNICEF, Chairman of the UNDP, World Bank, WHO Special Program of Research and Training on Tropical Diseases, and chairman of the Medical and Dental Council of Nigeria. He also taught public health at the universities of Lagos and Ibadan and was fellow of the Economic Development Institute of the World Bank. This clear and great thinker, a man well known for his excellent memory and physical health, somebody who loved sports, participated in a huge variety of sports, including squash and golf, was unexpectedly afflicted with this terrible illness that we know as dementia. In 2008, at Columbia University Medical Center, Dr. Gabby Williams was diagnosed with Alzheimer's disease. Alzheimer's disease is a degenerative condition of the brain, which leads to gradual loss of memory, loss of thinking skills, and gradual loss of movement. It is indeed a terrible disease. On the September the 11th, the day of our father's birthday, in 2017, when he turned 80 years old, which I have to say, he actually attended, the Gabby Williams Alzheimer's Foundation was inaugurated by his beloved wife, Dr. Mrs. Abisola Williams, and his children in his honor at the Metropolitan Club, Lagos. On Friday, 27th of July, 2018, after a short illness and 10 years of battling, really battling with Alzheimer's disease, our beloved father, Dr. Gabby Williams, husband, father, grandfather, brother, cousin, friend, colleague, and pioneer, a true pioneer of public health, passed to glory. He will never be forgotten. And now, let me hand over to MD, otherwise known as Mrs. Olatunji Gabby Williams, GWAF trustee, and today's moderator. Over to you, MD. Thank you very much.
Thank you very much, Lola Bailey, for that excellent welcome address and introduction of Gabby Williams Alzheimer's Foundation and the late Dr. Gabby Williams, in whose honor this foundation has been inaugurated. I would like to, before introducing any of the panelists, I'd like to first of all give an overview of COVID-19 in Nigeria today. The title of this webinar, this question and answer forum, the impact of COVID-19, the full title, the impact of COVID-19 public health crisis on the aged, dementia sufferers, and their caregivers. According to the National Center for Disease Control, as of today, 21st of May, 2020, our country has recorded 6,677 confirmed cases of COVID-19, 4,637 active cases of COVID-19, 1,840 discharged cases of COVID-19. So that's a felicity. 1,840 discharged cases. Deaths, sadly, 200. And we pray that this cup will pass from us. COVID-19 is holding the world hostage, maiming people, decimating communities across the globe. In 2020, when the new year came in, with its historic sound, very few of us anywhere guessed what history would be bringing in. So most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is to be well informed about the COVID-19 virus, the disease it causes, and how it spreads. At this time, there are no specific vaccines or treatments for COVID-19. However, there are many ongoing clinical trials evaluating potential treatments. The World Health Organization advises the public to stay informed through official situation reports, mythbusters available on government and WHO websites, and question and answer fora mediated by reliable sources. An implementing partner of the Federal Ministry of Health, Gabby Williams Alzheimer's Foundation has set up this Zoominar specifically to provide a question and answer forum. This forum will take questions from members of the GWAF community and take answers from experts with extensive knowledge of public health, aging, dementia, and our own local conditions. We start, though, with questions we have already gathered from various sources, targeted at each one of our experts on the panel. Before introducing our distinguished panelists, Dr. Salma Anaskolo, the Director of Family Health, who is able of the Federal Ministry of Health, who is ably represented today by Dr. Seydou Ahmed Dumbulwa of the Federal Ministry of Health. Dr. Salma Anaskolo has requested that he read the opening address for the session on her behalf. So Dr. Salma Anaskolo, her opening address, please. Dr. Seydou, over to you.
Thank you very much, Gabby Williams. I'm Dr. Seydou Ahmed Dumbulwa. I'm the National Coordinator for HEPIC for the Healthcare for the Aged. And my director actually tender her orders of appointment on that account. And I will read us, I'm just conveying the message to you. It's just a brief talk on the concern on the impact of COVID-19 on the age in Nigeria for the Gabby Williams webinar activity. She starts by actually the protocol, the chairman of the Gabby Williams, the distinguished panelists, and other invited guests. You are all welcome to this very important occasion. And I read the document as it was given to me. In the face of the unprecedented spread of COVID-19, we strongly support the commitment of NGOs and development partners to promote response to pandemic based on the health and social needs and the rights of all the people. In this regard, Federal Minister of Health welcome your webinar meeting on the COVID-19 impact on the aged and dementia sufferers. The government is deeply concerned regarding the devastating impact of the COVID-19 pandemic is having on the lives of the persons. We recognize that while the pandemic spreads among persons of all ages and conditions, all the persons are significantly higher risk of mortality and severe disease following infection, with those over 80 years old dying at 5 times the average rate globally and affecting 11% of people from 60 to 70 years and 14% 70% above in Nigeria. It is indeed very apt at a time when international and intergenerational solidarity from both public and private sector, health sector is needed the most. Federal Ministry of Health is deeply concerned about the escalation of ageism, including age discrimination and stigmatization of older persons, which aggravates their vulnerabilities, especially among the dementia patients in Nigeria. We are informed about the distressing reports indicating instances of neglect and mistreatment of dementia patients, as well as high rates of mortality due to COVID-19, which are affecting older people living. We are also concerned about the situation of all the persons who are quarantined or locked down with family members with or without caregivers, who may also face high risk of discrimination, domestic violence, abuse, and neglect among dementia patients. In the spirit of inclusiveness, we must scale up our efforts and strengthen measures to protect all the persons. The threats faced by all the people in the humanitarian settings, limited healthcare, nutritious food, and barriers to humanitarian assistance can exacerbate their risk during the COVID-19 pandemic. In this regard, we have developed an action plan in response to the impact of COVID-19 among all the population during the pandemic in Nigeria. We recognize that all the persons make substantial contribution to sustainable development efforts, including through their experience and their active, meaningful participation in society. In that essence, it is imperative to fully empower all the persons, to allow them to effectively make that contribution as active, autonomous, and independent agents and beneficiaries of change. As you all know, that all the persons are not homogeneous. Some as old as 70, 80 are non-frail. As we are mindful in our response to COVID-19 for all the persons, we must ensure participation of all the people to be inclusive of their specific needs and ensure the highest attainable standard of physical and mental health, access to life-saving treatments, their social and economic well-being on equal basis, which others is protected also. We are committed through implementation of healthy aging framework of our HEPIC project, fully promote healthy aging of all the person and to mitigate the negative impacts during and after COVID-19 pandemic on their healthcare, lives, and well-being. The ministry is ready to work with all partners to strengthen targeted responses to address the health and social needs of all the persons and foster age-friendly environment that will improve their functional ability. Lastly, before I conclude, I must inform you that we see Gabby Williams as an icon, a model of public health in Nigeria. His contribution to the health sector is tremendous. Actually, it can never be forgotten. You will live to remember Gabby Williams for most of the senior people in the ministry and some of the very senior people in the public health field in the country for his own contribution. We thank you, and you are all welcome to this very important meeting. You are all welcome. Thank you very much.
Thank you very much, Dr. Seydou Ahmed Dumbulwa, speaking on behalf of the Director of Family Health at the Federal Ministry of Health, Dr. Salma Anaskolo. Before I proceed to the panels and to the panel and the panelists, I would like to recognize the presence with us of Dr. Mrs. Abisola Gabby Williams, widow of the late Dr. Gabby Williams and chairman of the Board of Trustees of Gabby Williams Alzheimer's Foundation. Welcome, madam. It's lovely to have you with us. Now, to introduce our distinguished panelists. Professor Adeshola Oguniyi is a very distinguished man indeed. Let me just try and find my notes on Professor. He is a professor of medicine. It's an arm's length. He's a clinician, a neurologist, a neuroepidemiologist. He holds faculty position at the College of Medicine, University of Ibadan, is a consultant neurologist to the University College Hospital, Ibadan. He is the principal investigator of the Grand Challenges Canada-funded research titled Identification and Intervention for Dementia in Elderly Africans that is currently being scaled up. I'm deliberately going to abridge your very distinguished CV, sir, because I think that we all get a pretty clear idea of your distinction and erudition on this panel. Because we're very excited to hear what you have to say going forward. So if you don't mind, I'll move on to Dr. Toyin Salawu, who is a public health and systems development expert with 30 years plus at the national and international levels of experience. She worked for several years with the Federal Ministry of Health, and she served as head of epidemiology and disease surveillance and control, child health, HIV/AIDS, nutrition, and primary health for the Federal Ministry of Health, Nigeria. During retirement, she works as a freelance consultant at the national and international realms, which includes work with the WHO. She has a passion for community development and empowerment, as there can be no sustainable development in the continent without addressing these areas. Dr. Cheluchi Oyemelukwe is a leading health expert. She has a PhD in law, a lawyer, so the doctor refers to her PhD in law, not to the medical practice. But she's a leading expert in health law and works extensively in the social sector. Health systems law, policy, mental health, gender, child protection, research, ethics, migration. She advises on health sector reform nationally and internationally, including in the areas of public health law and ethics. She's currently an associate professor at Babcock University of Law, where she provides legal and regulatory advice. She provides legal and regulatory advisory in the private sector, advising healthcare companies and international development organizations. She has done extensive work on mental health law. So now back to you, Dr. Seydou Ahmed Doumbouloua. At the Federal Ministry of Health, you are the national coordinator of the Healthy Aging Project. You're a medical doctor, you're a trained public health specialist from the University of London, and a WHO certified healthy aging expert. You've chaired the West African Workshop for the development of the Strategic Development Plan for Healthy Aging, and you co-chaired the first ECOWAS Regional Conference on the Rights of Older Persons. Dr. Olajide Williams, Professor Olajide Gabby Williams, is the Secretary to the Board of Trustees of Gabby Williams Alzheimer's Foundation. He is a stroke expert, a dementia and Alzheimer's expert. He's a professor of neurology at Columbia University Teaching Hospital. So welcome to all of you distinguished panelists. My name is Olaton Gabby Williams. I'm a trustee of Gabby Williams Alzheimer's Foundation and the moderator of today's Q&A. So let's launch into the questions, first of all, that we've gathered from various sources before we start taking questions from the audience. So I'd like to start with Professor Oguni. Are persons with dementia, sir, at increased risk of COVID-19 infection?
Yes, I would say they're at increased risk of COVID infection because they have a pre-existing medical condition and they are likely to be frail. And because of their age and all these coexisting medical conditions that can predispose to dementia, they may be at increased risk of COVID infection. The other possibility is contamination by people looking after them, who may themselves harbor the virus and then transfer it to them. So because of increased contact with people who may have the disease, or because of where they are being managed, like nursing homes and co, they may be at increased risk of developing COVID infection. Thank you.
Thank you so much. The next question is for Dr. Toyin Salau. How can you protect an older person from COVID infection?
I would like to, first of all, congratulate the organizers of this webinar, because listening to all the response, at least the experience of the government in managing COVID, I haven't actually seen any provision for people with dementia. We have messages to the general public. There's been not much information given to people with dementia or other vulnerable group of people. So I'd like to congratulate you, you've done well. My second remark is dementia and COVID have two things in common. Both of them are emerging because dementia is an emerging pandemic in an aging society. And we know that COVID is an emerging disease, and it also exists in the pandemic form, affecting almost everywhere in the world. So how do we protect the people living with dementia from COVID? First of all, as much as possible, we should try and make sure that they lead a normal life as possible, because if there's any disruption in their family life or something, because of their condition, they're likely to have mental disorder, psychosocial disorders that will probably affect them. Also, because in addition to all this, the protective messages we've been hearing about personal hygiene is very difficult for people with dementia because you can tell them to wash their hands frequently. They might not remember. They might not even remember how to do it, when to do it, and for how long. So the challenge here is, apart from just giving them the message, they need to be supported, assisted to do this and reminded from time to time. Also, the issue of social distancing, we find that people with dementia are probably will feel isolated when they don't have people around them. So although we need to practice social distancing, we must make sure that at the same time there must be contact with them through the social media or FaceTime, calls to them, although there might not be any physical contact with them. Also, apart from the physical protection that we give them, we should also look at the mental health and psychosocial support that they would need. So what I would just say that to protect them, we need to make sure that the message we're passing to them in terms of personal hygiene, hand washing frequently, respiratory etiquette when they sneeze, when they cough into tissue, the tissue should be disposed of, or using elbow. What's it called? The measuring of distance spacing, 2 meters or 5 feet spacing with the next person. Also, we need to protect them because they're vulnerable, as we've been told they are at risk to any of these conditions, as much as possible, to reduce the number of travels to clinics or health facilities so that they don't get unnecessarily exposed. They should also be protected by giving them good food, nutrition, immune boosters in terms of multivitamins and all the things that they would need to boost their immunity, because they have lower immunity. And I think as much as possible, we provide some protection for them from the effect of all the protocols of reducing COVID in the community. Thank you.
Thank you so much, Dr. Salau. My next question is for Dr. Cheluchi Oyemelukwe. What is the state of the law regarding older persons and people living with dementia?
Thank you for that question, and thank you for having me at this panel. It's tremendous that you're doing this, and like the earlier speaker just pointed out, dementia is not something that we have quite talked about in the context of COVID, and so it's really just great that this is happening, and I'm hoping that this helps to bring more awareness even to the governmental agencies that this is something that needs to be addressed. I know NCDC has put out a lot of advisories, but this is one area that has been conspicuously missing. And just on the back of that, that is how the law also really treats aging, generally speaking, elderly people, and dementia. There's quite a bit that is currently missing in terms of law and in terms of implementation. So in general, of course, as you know, there are different parts of our law that directly affect people that are getting older, people living with all kinds of conditions in old age, and so on. So things around, for example, wills and estates and pensions law. But apart from that, you also have just broad provisions in our Constitution that provides fundamental rights for everyone, that provides for the directive principles and state policies that the country should abide by or comply with, and so on. But in recent years, we've done a few things. So for example, we passed the National Senior Citizen Center Act in 2018. That act aims to provide, a national center that would provide social and other kinds of services for older persons. It doesn't specifically mention dementia. And in fact, it does have a provision in there that says that if a person develops certain conditions that might make them unable to participate fully in the activities of the center and so on, then they should be removed from the center and not be allowed in, and so on and so forth. It's very interesting to read that provision because I feel that having not made any provisions specifically for people living with dementia and other kinds of conditions, that might actually be somewhat discriminatory. But the center, the Act aims to provide this center that should identify the needs of senior citizens, as it terms it in the Act, training, provision of recreational, sports, educational services, and so on and so forth, and other kinds of productive activities for senior citizens. Since it was signed into law in 2018, not much has been heard about it, and not much appears to be in the process of being done. And you would assume that during this period, this is something you would be hearing more about, but it's not. So that's one thing that the law has done in Nigeria. And then you have also other kinds of pieces of legislation that might have an impact on older persons. For example, the Discrimination Against Persons Living with Disabilities Prohibition Act of 2018 as well. In Section 21 of that particular act, it provides for the unfettered access to health care for people living with different kinds of disability. It doesn't specifically define or provide room for dementia, but one might assume that in terms of, if you're looking at mental disability, that might be an umbrella under which we can bring dementia. Again, this is an act that is currently on the books, but it's not necessarily being implemented fully at this time. You also have the mental health bill, which is currently before the National Assembly. And one hopes that within that particular bill, we will begin to see much more attention specifically to the challenges and issues surrounding dementia. So in essence, that's the state of the law. You have all kinds of challenges that Dr. Salahu just mentioned. For example, you have issues around isolation, social isolation. You also have issues around elder abuse. And the current, the laws that we currently have in place do not necessarily address these issues. You have things around substitute decision-making, advanced directives, and so on. Where these things are addressed, they're addressed extremely generally and do not take into consideration the specific challenges that people who are older might face, or people who are living with conditions such as dementia. So in essence, I mean, that's just a broad stroke of a brush really through what our laws currently provide. You have the Constitution that provides the rights for everybody. You have this really interesting law, the National Senior Citizens Center Act, which sounds wonderful on the surface, but doesn't go into some of those key challenges. I mean, even people living with other conditions like macular degeneration, for example, would probably not be able to take much benefit from this act. And so, these are some of the conversations that I'm hoping that as the day progresses, we're going to have. Thank you.
Thank you so much. Can I'd like to progress this as quickly as possible. With all due respect to all my distinguished panelists, there's so much to talk about, I know. But can we try and restrict the answers to just about 3 minutes so we can really touch on as many areas as possible and come back to these areas at a later stage in the conversation. Seeing as Dr. Oyemelukwe talked about the law and the state, I'd like to throw it over to Dr. Seydou Doumbouloua. If you'd like to respond to some of the points that Dr. Oyemelukwe has made, and also take a question from the audience, a gentleman, Mr. Adekola, who asked, what is the plan of the state for people living with dementia? But what I want you to do first of all, sir, is to just respond very quickly to Dr. Oyemelukwe. She's asked a few questions within her answer before you progress to what is the plan of the state for people living with dementia. Thank you.
Okay, thank you very much, Dr. Oyemelukwe, for your own very thoughtful one observation. Actually, I must say that the National South National Senior Citizen Act actually participated. I personally participated after private sector engagement of it, and they brought it to the ministry. We were able to evaluate it and push it. You understand? And subsequently, it was actually approved, passed by the Assembly, and actually assented by Mr. President. At the moment now, the reason why up to now, this moment, actually has not been put into a real operational is because of the issue of the restructuring of ministries. You know, the ministries usually to us in the Ministry of Social Development and part of it, Ministry of Health, because it's encompassing of the health and social component, the healthcare health activity, aged activity. You know, so it was domiciled in the Ministry of Social Development. So now that the Ministry of Women Affairs, Social Development actually has been divided, now they created Ministry of Humanitarian. That component, that part, the aging part, department division, has now moved to the Ministry of Humanitarian, Disaster Management and Social Development. That is the reason why we're having this kind of delay, but actually we are very much committed to it, because I think that is one of the valuable things that this government has done, and we will actually follow it tenaciously to ensure that this is actually implemented for the benefit of the. And on the second issue, which is related to support, health social support and other things for the dementia, we have what is called Basic Health Provision Fund. This Basic Health Provision Fund is meant to procure health services for the people who are vulnerable, the children, the women, and the elderly. And at the moment now, the Minister of Health has actually agreed, there is a ministerial pronouncement that all people who are vulnerable, who are over 60 years, should actually be considered and be captured under the Basic Healthcare Provision Fund. You understand? This Healthcare Provision Fund is the one saying of the consolidated fund that actually goes down to the Minister of Health, and actually 50% goes to health insurance and 40% to the primary healthcare development agency. It's meant to procure services to provide health insurance for the vulnerable population. And it is also actually now evolving, even though because of this COVID that actually came now, will have actually gone far in terms of how far, how peaceful it's going to be done, and who is it going to be real 60, over 60 years or 65, so that they're accessing and having health insurance for them. Thank you very much.
Thank you very much. So have you addressed the issue, the question from the audience? What is the plan of the state for people living with dementia? Are you satisfied with that response? Does it encompass your answer to that question, sir?
In addition to what I have said earlier, we have developed an action plan and trying to create a database of all Nigerians over 60 years. You understand? It is only when you have a database of them, you can read them, you'll be able to actually know, okay, where they are and how you can reach out to them. You understand? We are a developing country, unlike other systems, other parts of the world where the system is fully developed. Here, the system is not fully developed. We're trying to actually make it very much developed and effective. You understand? So the database, we are working on it under the Health Management Information System to see how we are going to get this system. Last year, I remember there was similar thing on dementia in Ibadan. Professor Guni was there, and that's actually what kind of a troubleshoot for the government to see what the government needs to do to see how people living with dementia are actually being supported.
Thank you very much, Dr. Seydou Ahmed Dumbulwa. Dr. Oguni, would you like to make a comment to that before we move on to something a lot more practical? I want to also take it down from the law and theories and policies and make it very tangible for everyday people, caregivers, and those early stage dementia sufferers. So do you want to make a comment to either Dr. Oyemelukwe or to Dr. Dumbulwa before we move on to the more practical aspects of the question and answer forum? Professor Oguni.
No, I have nothing to add. I think Dr. Dumbulwa had covered the the subject very well. So I have nothing to add. Thank you.
Thank you. So now I move to my second question for you, sir, Professor Oguniyi. How will social distancing affect dementia care?
Social distancing, which has been recommended for keeping COVID away from people, is going to affect individuals with dementia because they're going to be left isolated and it's not good for them. They'll become very anxious, they will become very irritable, and they become unsafe. And this may add to their medical problems because they then develop mental health issues. It is important that this be done. Of course, we have problems of space. To maintain adequate spacing, you need about 2 meters between patients, and we have very few facilities where you can arrange that to keep patients away from each other. It also affects family members coming to visit them because of distancing, you have to now count the number of people who are with the patient at any time, and they cannot stay around the bed or where the patient is sitting or the individual with dementia. So overall, social distancing is not very good, but it's the way to go in terms of keeping them from contacting the infection. And so we just have to do that, and we have to preach that all the time for any individual who's coming to see a patient with dementia. They come there, do whatever they need to do, wearing masks with their hands washed already, and they don't get too close to the patient with dementia so that they don't transmit any infection to such individual. Thank you.
Thank you very much, sir. This next question is for Dr. Williams, Professor Jide Williams. Do the symptoms of COVID-19 differ in older adults compared with the general population?
Well, thank you very much for that question. The symptoms can be much more severe among the elderly. And that's been borne out by the experience that we have here in New York City. In New York City, we have over 330,000 people with COVID-19. We have over 20,000 deaths from people with COVID-19. And at my hospital, at Columbia University Medical Center, we've discharged over 7,000 people with COVID-19. One of the things that we're seeing is often those individuals who end up in the ICU or who end up dying are often those who are either elderly, that is aged over 65 years old, or those who have what we call multiple comorbidities. In other words, those who might have pre-existing lung disease, those who have diabetes, those who are obese, those who are generally medically frail from other illnesses tend to be the ones who succumb to COVID-19. So yes, we do have, it is much more severe among the elderly, particularly those over 65.
Thank you so much. And Dr. Salawu, how would you manage the need for routine medical care for a person living with Alzheimer's during the pandemic?
Unfortunately, because COVID has consumed all the health service, routine care for chronic diseases is not readily available now. In fact, it's so bad that I'm not even sure they're giving immunization in this country anymore. So a person who has dementia probably has other comorbidity, has a problem because he might not be able to access the other problems that they have, like diabetes, hypertension, or any other thing. So what can be, what's suggested or recommended is that since that service is not available, we can use telemedicine or telehealth, okay, using the social media to get access to a healthcare provider. Also, because there might not be service available for some, like I said, chronic diseases, one can request for long-term supply of medication, maybe 1 to 3 months supply, make available to them for the treatment, and also essential medicine like things that you can use for headache, fever, malaria, and all that. So I think that's, as much as possible, we should try and reduce the visit to hospital so that they do not get exposed because of the existing conditions. Because if they get exposed and they get infected, they're likely to have severe symptoms. So one would advise that you use telehealth, but if that's not possible, because in our environment here, very few people have access to internet facility. Even power is a luxury. So as much as possible, we can use a telephone to call a healthcare provider, and also make sure that we have enough supply of medication for like 2 to 3 months available.
Thank you very much, Dr. Salawu. Would anyone like to contribute to that, the management of people living with Alzheimer's by caregivers? Professor Oguni, would you like to add to that, sir?
In addition, we must be sure that the caregivers themselves do not have COVID infection, so they don't transmit infection to them. And they must be properly trained on how to handle their wastes and all that, so that there's no contamination, and provide their medications as and when due and proper feeding. Those are all key points in managing individuals with dementia.
Thank you so much. Thank you. This question is for Jide, Professor Jide Williams, Gabby Williams. In what ways has COVID-19 infection contributed to increased caregiver burden for persons with dementia? In what ways has COVID-19 infection contributed to increased caregiver burdens for persons with dementia?
Well, what we've experienced here in New York are severe caregiver depression, severe caregiver distress. We've had situations where caregivers have actually needed mental health treatment, because imagine a situation where you really can't move around freely with the person with dementia. You can't go out. There are no recreational activities. People are socially distancing. You can't take them out for a walk. You can't take them to places where they can interact with other people, and all of these activities can be very, very hard on both the caregiver and the patient with dementia. You know, patients with dementia do best when they have routines. You know, they have set routines, and those routines take place within their familiar environments. Once those routines have been disrupted, you know, if a patient is used to going to this place every day, or going to maybe physical therapy, or going for a recreational activity every day, and if these things are disrupted, then what happens is that these dementia sufferers become very agitated. They can develop very severe agitation, severe behavioral problems that might need to be treated with medications, and all of these all of this excess agitation and behavioral disruptions and even frank psychosis that can occur when you disrupt the routine of a dementia patient can lead to severe caregiver distress, severe caregiver depression. You know, they can't even take their loved ones to visit to the hospital, because sometimes they're worried that they're going to be exposing their loved ones to the virus during situations where there's a lockdown of the whole city and people can't go out. That exacerbates the agitation that these dementia patients suffer. So it is really a tall order for caregivers to deal with all the different stresses that come from taking care of their loved one in a situation, in a social situation that COVID-19 imposes on societies, which is why we need to monitor not only the patients and try to treat these behaviors much more quickly, and but we also have to pay close attention to the caregivers and the amount of emotional distress that they're going through, and try to help them through it as well. But the COVID-19 has put enormous stress on caring for patients with dementia.
Is there an ideal management that also encompasses the stresses of these caregivers? Is there an ideal management plan that's in circulation, maybe in more advanced countries, for persons with dementia that also encompasses the caregivers? Is that something that's being evolved or something that's already being implemented?
Well, what we're doing here at Columbia is that we have, which is very different. We have ubiquitous access. There's ubiquitous access to technology here. There's ubiquitous access by most families to internet services and Wi-Fi services. And so, although there are still disparities within certain communities, especially the more impoverished communities that might not have the same type of access, but for the most part, most people can access telemedicine, and then we can engage both patients and their caregivers through telehealth. And so what we're finding is that we are doing many visits, many telemedicine, telehealth visits with our caregivers, and we are providing psychological support through telehealth platforms, a psychological, behavioral treatments of their loved ones. Where sometimes the caregiver actually films the behaviors of the patient with their iPhones and send the physicians those videos so we can analyze these behaviors, and then based on that more objective data that we have, we can then treat them with different types of antipsychotic medications. But there is no set algorithm that applies to all societies and all communities and all patients. I think these situations need to be individualized, patient by patient, as we say, case by case, because there are nuances for every different patient. But what we broadly do is we treat the behavioral disorders and the increase in agitation. We provide counseling and psychological support for the caregivers, and we do so through telehealth platforms, and we do so more frequently so that we can monitor their progress.
Thank you so much, Professor Williams. This question is from one of our participants on the Facebook Live session. Is Victor Omorigwe, who's a very keen supporter of Gabby Williams Alzheimer's Foundation. And I think that this might speak to what you've just been talking about. How can physician experts collaborate with caregivers in the course of care of people living with dementia? And he also talks about local research in AD, which might be a bit of out on a limb, but can you respond to that? I'll also pass it on to Professor Guni once you finish, Professor Williams.
Yes, I mean, I think it's very important for there to be access between physicians and caregivers of dementia patients, especially those dementia patients who are having very difficult behavioral problems. Again, I can speak for what we do here, is that we use telehealth and telemedicine because of the social distancing implications. And when things are very, very serious, at that point, that might trigger an in-person visit to the hospital. But we try very hard to keep these elderly dementia patients away from the hospital, and we try to manage them through our teleconsultations. But there are times when they have to come in and they have to be admitted and they have to be treated as inpatients. But I do think that the important thing is really access, is establishing an access continuum between those who are caring for dementia patients and the physicians. And obviously, New York City is very different to Nigeria, and so I would defer to the esteemed Professor Guni with regards to how this is being done in Nigeria.
Thank you so much, Professor Williams. Over to you, Professor Buni. How can physician experts collaborate with caregivers in the course of care of people living with dementia, and we're talking about in the context of COVID-19 particularly?
I agree. Thank you very much. I agree with what Jide has said. It should actually start before COVID era, not that we wait until COVID. So we should start empowering caregivers on how best to care for individuals with dementia. They must understand the symptomatology, the red flags when there are problems, and how to help them. And then we must take care of their distress, because they are the ones that actually bear the brunt of this illness. They have lots of psychiatric problems, depression, anxiety, and psychosis, as Jide has said. So we need to look after them. During the COVID era, we have to talk to them, because now they have to spend longer hours with individuals with dementia who may be in nursing homes or in hospitals or even at home. In Nigeria, we have curfew, and which means that after a certain period, they may not be able to go home. So they have to stay longer hours and bear the stress of looking after the patient all through the night. So they lack sleep, they may not have good meals, and they are stressed. And so we are supposed to expect them to undergo some of these things, and we talk to them before so that they can be fully equipped to manage these problems when they arise. Thank you.
Thank you so much. So over to Cheluchi. I'm going to be lapsing into first names quite often now, because I think that
So unfortunately, I have actually to go and see a patient now. So it's been really an honor to be part of this distinguished panel.
Thank you so much, Professor Williams. Jide, you're always such an asset to every panel, full of information and the riches of your experience. And we wish you all the best on the front lines of the war against COVID-19. God bless you. Thank you so much for coming in. Thank you so much, Jide. This is for Cheluchi, because I think this speaks very much to your own concerns, what we've just been talking about, Professor Guni and Professor Williams. How would you suggest we create better awareness of dementia, the challenges of living with dementia, and how can the law provide support for caregivers and caregiving? Professor Guni and Professor Williams have set the scene for your response. A nice, concise response for us, please.
So I just think that we just need to have the conversations. I don't think that we're having enough of the conversations. I think that perhaps in the Southwest, there's much more conversations about this going on than you would find in the East and in other parts of Nigeria. And I think that that is really what it comes down to. We need to get on social media, share some of these experiences in ways that people can begin to understand. And of course, be part of the policy conversation. So for example, somebody mentioned the Basic Healthcare Provision Fund. I was part of working on that, and I know that this is not necessarily something that we discussed in detail. So just three things that I've said, just having the conversations more broadly so that people on the ground, everyday people begin to understand it. Right now, there's not that much awareness of it. So just having those conversations in a way that people can understand. Secondly, using social media more. With what has happened with COVID, well, most people, practically everybody is using one form of social media or the other and using digital platforms. We need to make more use of that in sharing information about this. So I'm really excited about what we're doing with this panel. And then finally, just having policy conversations. How can we, address dementia within our policies, within our legislation, address those key challenges that we have? Those are the three things that I would like to offer.
Thank you. Thank you so much, Cheluchi. Over to you, Dr. Seydou Jumbulwa. I think that you probably have quite a lot to say to these points that Cheluchi has made, Professor Oguni and my brother have made, because you're the state. So we're talking about, yes, the provision made for caregivers, awareness of dementia, the provision made for dementia, and government projects for healthcare for the aged before COVID and during COVID.
All right. Well, I think let me just respond to the issue of the caregivers and the other awareness we're doing before I actually move to the healthcare for the age program we have in the ministry. Ministry of Health is very much concerned about the caregivers, but in the civil service we have what is called establishment issues. If somebody is actually working in the government or private sector, it needs to be promoted, it needs to grow. So we need to have established a kind of establishment of cadre for caregivers, because now if you put a caregiver in general teaching hospital, maybe one part of the geriatric medicine, you understand, okay, these are caregivers. So for them to grow is going to be a problem because they're not part of the civil service rules, you understand, the establishment, so to say. So this is one of the things that we have actually noted. And the second thing, we are trying to compile the list of all home cares, in the country and the carers. And also now the Nursing and Midwifery Council are actually coming up with something very new on how sort of a kind of a caregiver at the rural level. They train them, they certify them, and they actually take them back to their own rural area. So this is all part of it, capacity development and awareness, both at the rural area and to enable people have to have enough human resource that actually look after people who are aged and also the dementia. And then the second issue of the healthcare for the aged, this healthcare for the aged, that is HAPPY project, is a project that actually came in 2016 following the WHO resolution and the commitment of the member state country for every member state country to come up with a project or program on how to address the healthcare social needs of the aging population. Aging population is ever increased in the developing, even in the developing country now, you understand? So we came quickly, in 2016, we came with this project with 4 pillars. It has 4 pillars. Mainly, we are trying to actually address the issue of geriatric care, to actually develop the capacity of the healthcare workforce, to actually the issue of the research and development related to issue of the Alzheimer's, dementia, so on and so forth. Then issues of the 4th pillar is the health social support, which involves social security and so on and so forth. People will be giving health insurance, free health insurance, to enable them to access healthcare, with the government need to procure on basic healthcare provision fund, which is actually undergoing renewal, because the post healthcare provision has not actually captured in specific, the welfare or the provision of the health insurance for the aging population. But the review that is actually going on is specific that it must capture the vulnerable population specific to the age, people who are over 60 years. So this is somebody what we're actually doing before COVID. Now in COVID, with the coming of COVID, we observe the most affected people are people who are over 60 years. You understand? All the process, which is the global trend. So we decided to actually come up with an action plan that will be able to provide geriatric services, and even at the community level, targeting at least 80% of the population, 80% of the people population in the country, you understand, to enable them to have access, to strengthen the health system, to get database, promote healthy age, provide a very good age-friendly environment, and also provide some total amount in the form of social security, in terms of cash transfer, to enable actually procure the services they need for their own health. This is in summary actually of the action plan we have in place, and it's going to be integrated in the national health response, which is going to be implemented soon by the country for the federal government.
Thank you very much, Dr. Dumlua. Now we're moving again from policy to practical considerations of dementia. Is COVID-19, this question is for Professor Oguni, is the COVID-19 pandemic likely to lead to an increase in the burden of dementia globally?
Thank you very much. It is very likely that the number of cases or number of individuals who will have dementia might increase, because the initial impression that the virus attacks only the lungs and the kidneys and the heart has been disproved, because the brain is now affected and it causes stroke in them. And we know that stroke is associated with vascular cognitive impairment and dementia. There's also infection of the brain. So it is possible that number of cases number of individuals who suffer from COVID infection might have stroke, which can lead to dementia. The infection itself affecting those who have other pre-existing condition can predispose them to dementia. So my take on this is that it is possible that number of cases with dementia will increase, but I pray not. Thank you.
Thank you so much. This question, thank you, Professor. This question is for Center for Happy Elderly People, one of our partner non-profits. It's an elderly care home. And they ask, how can care homes access free coronavirus screening before admission to old people's homes? Can I ask Dr. Salawu to answer that question, and then might give it to the state. How can care homes access free coronavirus screening before admission to old people's homes?
The first thing to do is to just use the thermometer to measure, to take the temperature of the caregiver, okay? If that person has a fever, like 138 degrees centigrade or 100 degrees Fahrenheit, that person is excluded, must not go near a home. Secondly, take a history. Ask the person if he's had any contact with somebody who has been COVID positive, okay? Also, who has history of travel from a COVID infected place. So that is number 2. Then the other thing is, you look at the protocol of the home, okay? And look at it in line with what government is saying about COVID prevention. And in the homes, you should be able to have, at least in those long-term homes, you should be able to have facilities that will be big enough that one can practice social distancing, facilities that will be able to have isolation facility in case a patient has symptoms, sorry, not a patient, one of the person has temperature or other signs of COVID. So isolate that person before you talk to the relevant authority, like calling them, describing the symptoms, and having them to come and investigate. Second, and then fourthly, one needs to have enough security that you don't have people just coming in and out of the facility, so that these people are not exposed to COVID infection. And I know in some facilities, they don't allow visitors, even family members are not even allowed to come in to visit or see the people with dementia. I think that's, then thereafter, if there's any case where the patient, where the person has developed COVID or has symptoms of COVID, not developed, has symptoms of COVID, then one can call in the NCDC to come and investigate and possibly move the patient from the health facility, from the center. Sorry.
Would you, thank you so much, Dr. Salawu. Dr. Seidu Jumbulwa, would you like to respond to that? How can care homes access free coronavirus screening before admission to old people's homes?
Well, actually, just to add up what she have actually said, is that they need to, in the screening testing, we have probable case, probable case, confirmed case. So there are indications for somebody to be tested, because we have not yet actually started with a massive testing. We are trying to ramp up everything. So now what we do, we are the laid out criteria. So if such things happen, what they are supposed to do is to call the NCDC. You understand? Call the NCDC and inform them, look, this is what's going on, you understand? Or even now, they can actually write a letter officially to the minister, and the minister goes down to the NCDC. This is an issue, it's an oversight. It appears the NCDC have not actually looked into this place, even have introduced a home care guideline, how to go about it, but yet there is a need to make provisions of this free testing, COVID-19 testing available and accessible across to this home care. You understand? For instance, what I'm trying to say here is that, for instance, we have maybe some home cares in Ibadan. You understand? So whenever there is an allocation or allocation to the state or your state, you understand, certain percentage should be dedicated, you understand, that this is dedicated for the home care. So they should actually come and be accessing questions, and they have a direct line, because if it's going to be calling to NCDC national, there may be a problem, you understand, because of the traffic, you know, associated with it. So let them actually go to the local emergency operating center. There's a certain percentage of maybe 1 or 2% of the test kit given the state should be actually dedicated to the LD, you understand, so that they will also help. Until when the national mass actually testing actually commence, the mobile test, as we're actually proposing, is going to, with the governments actually are keen in to start the mobile testing, free testing of COVID-19, which is going to be faster and also more accessible and affordable of this harm. Thank you.
Thank you so much, Dr. Seydou Doumbouloua. I have two questions here which seem to me to be fairly similar. One is from Fola Oluwemi, and the other one is from O.M. Adekola. O.M. Adekola says, we started seeing symptoms like falls and confusion with our clients. Are these symptoms of COVID-19? And Fola Oluwemi says, are the symptoms of COVID-19 different from dementia for dementia patients compared to the general population? I'd like to give that question to Professor Ogunniyi, please.
Thank you very much. Jide actually explained earlier that the symptoms of COVID in individuals with dementia are different from the general public. So I don't have a lot of experience with that, but from what we read, it is possible that apart from the confusional state that they will experience, they may have respiratory symptoms, and they may also have increased weakness on one side of the body or the like. So that is likely, but I think they have additional symptoms on top of their memory problems and the other features of dementia that they have. Now, the first question, I didn't get that clearly, please.
I can repeat it. We started seeing, this is a gentleman or a woman who works in an elderly care home. We started seeing symptoms like falls and confusion with our clients. Are these symptoms of COVID-19?
Thank you very much. Now, the COVID infection, the manifestations are protean, and it's like we see new features appearing from time to time. It's not been documented that falls will occur in individuals with COVID infection, although some of them can have Guillain-Barré syndrome, which will result in paralysis. Confusional state can occur in them. It may be a feature of COVID infection, especially where there is reduced blood supply to the brain or there is infection of the brain. So it is possible that these are new features of COVID infection, but we need to document these in as many patients as possible before we take this as a new manifestation of COVID infection in our patients with dementia. Thank you.
Well,
or in the general population.
Thank you so much, Professor. This ties in with the question I need to ask you. What are the effects of COVID-19 on the brain, and how can these affect individuals already diagnosed with dementia? It doesn't matter if we overlap, because I think repetition is very good for people to retain what the experts are saying.
Yeah.
So I'm not going to worry too much if we overlap and in questions intersect.
Yes.
So yes, what are
Thank
the
you
effects
again.
of COVID-19 on the brain?
These have been covered before, and we can just repeat them. That we have confusional state, we have a febrile illness. Individuals who have seizures may have worsening of their seizures. These have been documented. So an epileptic can have more seizures than before. We can have new strokes appearing, especially in younger individuals. Before, we used to associate stroke with old age, 60 and above, but now we have them in individuals who are younger. We've had individuals who present with loss of smell, which may be the primary presentation, and without any other thing. And then individuals who have dementia will have worsening of their mental capability or cognitive ability, and they become more functionally dependent. We've had individuals who develop weakness of all the extremities in an ascending fashion, which has been described as Guillain-Barré syndrome. Confusional state, somebody has just mentioned falls in some of the patients. I think these are new features that we're seeing. I think it's an open book, and as many symptoms as possible as can be documented in as many patients as possible as are reviewed and tested, would make a complete picture of how COVID affects the brain. So we can say basically all parts of the brain can be affected and the manifestations could be quite varied, but the consistent ones are confusional state, seizures, stroke, headache, loss of smell. Thank you.
Thank you very much. This question is for Dr. Seydou Ahmed Doumbouloua. The lockdown in many states will affect economic activities of family members of persons with dementia. What could be the impact of this on dementia care?
Looking at it from a larger or a more modern perspective, you see, economy, you understand, is very instrumental or is part of the real social needs of a dementia, you understand, health, economics, you understand. So if the lockdown, there is real lockdown, and actually there is no economic, financial insecurity, so to say, you understand, they certainly want to affect their own the treatment chain that actually they are receiving from their own healthcare providers. So they need the role for the government to actually come in to see how they can facilitate to sustain that chain, you know, so whether it's going to be by actually supplying such drugs or medical supplies to the to those affected, understand, or if there's any other way of doing in order to alleviate economic impact, you understand, in terms of the social insecurity, which is one of the most important things that must be addressed. In as much as the issue of the economic insecurity or social insecurity is not addressed, it may lead to other things, you know, around the dementia patient. The issue of domestic violence, you understand, coming, the issue of more neglect will come, because if the dementia patient is actually having some stable financial stability, you understand, he'll be able to actually brings people to actually give him support, caregivers will be with him. If there's that issue or break of that financial insecurity, financial security, then certainly he's going to be vulnerable or predisposed to some of these social problems.
Thank you very much, Dr. Doumbouloua. We don't have too much time left, but I just have to take 3 more questions before I hand over to the chairman of the Board of Trustees for the vote of thanks. But it's been a riveting, really fascinating, informative panel. And I've just really enjoyed myself. And I hope all the audience who have been very good and joined us have really gained, because I've gained so much from this session. So I have just a few more questions left. And I'd like to just, another very practical question this time, which either Dr. Salawu or Professor Oguni can answer. And again, it's from a man or woman working in an elderly care home. She didn't specify, or he didn't specify, Adekola. And the question is, how is eating and swallowing difficulty managed during this pandemic? I can't quite work out the association, but maybe you can talk to that. How is eating habits and swallowing difficulty managed during this pandemic? Either Dr. Salawu, would you like to try?
Well, I think one of the symptoms of COVID is lack of appetite. Okay, some complain that they don't have appetite. So sometimes feeding might be difficult because of that. In terms of swallowing, well, maybe the virus is emerging. If it affects any part apart from the lungs, if you're not able to breathe properly, you might find it difficult to swallow. Okay, and I don't know, maybe Dr. Guni can help me out if there's any other things that you can add.
Professor Guni, would you like to add to this question about eating and swallowing?
Yeah, I think what we will then do for swallowing, if it's very bad, we may have to pass nasogastric tube for assisted feeding or use intravenous fluids. Now, eating, that is a problem. We may have to stimulate that, since Dr. Salawa said they have loss of appetite. So we have to give appetite stimulants, vitamins usually are the things that we'll use for these, or supplemental feeding. We must bear in mind that there must be social distancing while all these things are going on, which are some of the problems that will arise with managing individuals who have especially problems like this that require closer contact than other people. But non-contact and wearing PPEs, personal protective equipment, will reduce the chance of contamination. Thank you.
Thank you very much. This question is for Cheluchi. We've talked extensively about law, policy, laws not being properly talked about, not being properly, the lack of integration in policy, law, the state, the non-governmental actors. We've talked about that to what sounds to me like a fairly fractured system. Is that too harsh a way to put it? I don't know. And the need to have more conversations like this kind of panel where we have NGO actors, we have government actors, we have tertiary education represented, we have community development and private sector consultants represented on this panel. So what reforms, very specific, what reforms would you suggest to law and policy, Chiluchi, to really make this happen for the country, the care for the aged, the care for their caregivers, a more coherent, equitable system? What changes to law and policy would you advocate? In a nutshell, as far as possible. I know it's a huge topic, but as far as possible, as concisely as possible. And then I'm going to take it to Dr. Seydou Doumbouloua.
I just have two things to say. And the first is we already have some pieces of legislation in place that we're not implementing at the moment for reasons that Dr. Doumbouloua, for example, has tried to address. So, for example, the National Senior Citizens Center Act, we need to begin to do that. And I think that in the process of doing that, we need to have the conversations. Drafting law, I don't think is the most difficult thing that we can do. I think we just need to begin to even think that it is important to lay that foundation, to say that this is a matter that we all, that if we're lucky, if we're blessed, one day we'll be old, and perhaps we might have these sorts of challenges, and to begin to just sit down and have those policy conversations. At the moment, we're not having those conversations. We talk about universal health coverage. I've just heard this new thing about the Basic Healthcare Provision Fund trying to do something about geriatric care, but that is not a conversation that is on the front burner, and we need to put it on the front burner. Once we put it on the front burner, then lawmaking becomes easy. But in lawmaking, we also have to think about implementation. So that's why I think that the first thing to do is to begin to have these conversations. And the second thing is to implement the current legislation that we have put in place. That will likely give us an opportunity to have all these all-important conversations that we need to have about the kinds of laws that we need to make, the funding that we need, because these are all the things that are going to be in that law, the kind of research that needs to take place, and the support that we need to give to organizations on something. These are all the kinds of things that you need to have. But if we don't have conversations, we can't begin to think about developing the kind of legislation that we want to see.
Thank you so much, Sheluchi. So this brings me to the sort of last question. So we're going to have the state, the government wrapping up before we hand over to the chairman of the Board of Trustees for the vote of thanks. But this is quite a chunky question. I'm going to introduce it with one of our trustees, Olatunde Gabby Williams, who asked Dr. Seydou Ahmed Doumbouloua, what are the urgent priorities of the government, knowing that our country is relatively low in development compared to Western countries? And if you can answer that plus this one, sir, do you have plans for providing health insurance to the older adults?
Yeah, of course. There is, that reminds me, that's just 2 months ago when the Minister of Health launched a elderly-friendly initiative in University of Benin Teachers, where he made a statement that the government is now committed to ensure that anybody who is over 60 years have health insurance through the gateway, NHIS gateway or the Basic Care Provision Fund. And he directed that actually the PTAD, the PENCOM, the Ministry of Health, and the NHIS should come together and deliberate on that subject matter to come with a final resolution. It was when we were actually trying to do this, then the COVID actually started raining all over us, and then we had to stop and actually go for the COVID. So I think we have enough momentum in terms of how to get there, you understand. But it is all-encompassing. It has to be in the spirit of inclusiveness, where everybody from all sectors need to support the media, the lawyers, the other politicians, other things, push it so that we actually actualize it. But really, it is in the pipeline, and you said there is a ministerial commitment, and we are actually optimistic that we'll get there and will actually make people access. But that commitment of everybody, in that spirit of inclusiveness, is very vital in this regard.
Thank you so much, Dr. Dumbulwa. And to my, my panel, you've just been fantastic. We promised the audience, all the stakeholders involved, and the members of the public who are going to watch it at 4 p.m. on YouTube, the replay, we promised them to talk about public health, family medicine, community service, aging, mental health, international health and disease control. We have covered every single ground. We've talked about law and policy. We've talked about the reforms necessary. We've talked about a coming together of all the relevant actors more often. And I think we have a perfect panel to make this happen. We have government represented, as I've said already. We have tertiary education represented. We have private sector consultancy, healthcare consultancy represented. We have the law represented. And we are a non-profit and very active, very dedicated. And it's with great pleasure that I hand over to Dr. Mrs. Abisola Gabby Williams, who inspired this foundation and who is the perfect person to express the foundation's appreciation to all of you and the audience who joined us. So over to you, Dr. Mrs. Abisola Williams, the Chair of the Board of Trustees.
I would like to express my deepest appreciation for our distinguished panelists who have done a great day this afternoon to enlighten us about the realities of COVID-19. As a nation, with a committed and dynamic leadership, continue to battle with this vicious and dreadful coronavirus pandemic that ravages our country and indeed all the nations around the globe, and its impact on dementia. First of all, I give thanks unto our Almighty God, who alone can still all the storms in our lives and can protect us from plague and pestilence. May I also express our immense gratitude to the Federal Ministry of Health for a wonderful partnership that started strong and is growing from strength to strength. I also like to thank Dr. Dumbulwa for all the nice things said about my husband. Thank you very much. God bless you. Let me thank Dr. Salma Anas Polo, Director of Family Health at the Federal Ministry of Health, for opening the session and our important remarks about the government's response to COVID-19. May I applaud and express our gratitude to the panelists for their knowledge and expertise conveyed with such clarity. The panelists are Dr. Seydou Ahmed Dumbulwa, representing the federal government, Federal Ministry of Health, Professor Adesola Ogunniyi, who has always been very, very supportive of the Gabby Williams Alzheimer Foundation, Dr. Toyin Salau, who is very much committed to public health and also an avid supporter, a committed and able supporter, an active member of GWAU. Also, my thanks goes to Dr. Cheluchi Onyemeluku, who really enlightened us about the health for the elderly people. She has brought also some very, very interesting points that I know that the federal government representative being here will convey it to the federal government so that can improve the health of our elders and also vulnerable people, and also in particular the dementia sufferers. I'd like to thank Professor Olajide Gabby Williams, and we thank God also for his promotion to the position of full professor with a tenure. We thank God for his life. And I want to thank from the deepest of my heart the moderator, dynamic, brilliant, erudite moderator, Olato Gabby Williams, who did a great job coordinating the panel discussion within a short time. I must salute the behind-scene works of Mrs. Mopelola Bailey and Engineer Olatunde Williams, Mr. B. Shoboade, the graphic advisor, and newly appointed senior officer of work, Mr. Peter Lanion, the technical advisor to GWAF, Mr. Terence Ogims, and with all their logistical support and all the staff that are involved. Without this, their work and their contribution, this webinar or seminar will not be a reality. We thank them immensely. And last but not the least, I must thank most profusely the audience. They have come from all over the world, from America, from Britain, and from other parts of the globe, and Nigeria in full force to make this day a very, very fruitful day. We owe you a lot of gratitude. May the Lord bless all of you. On behalf of the trustee of Gabby Williams Alzheimer Foundation, I say thank you, thank you, thank you. Stay safe, keep all the health guidelines, adhere to social distancing, and stay forever blessed. Thank you.
Thank you.
Thank you very much, and congratulations.
Thank you.
Goodbye, everybody. Thank you so much. Thank you.
Bye.
Thank you.
Bye.
Bye.
Thank you.